Another huge controversial weight loss topic is HCG. I can tell you from personal experience, from family experience, from professional experience with patients, HCG is one of the safest and most effective ways for therapeutic weight loss. It is a very simple, low-dose, bioidentical hormone that is used to stimulate the release of stored fat and to preserve lean body mass. That alone is enough to help someone lose weight and achieve the body type that they're looking for. The controversy stems from using hormones to all the way to having a restricted calorie diet and that it's a little too extreme and what have you. But what I found is when you are truly in ketosis and you're following the diet appropriately and you're not deviating and you're using real HCG, not some drops or something you found online, you're going to be very healthy and you're going to be getting the results that you are looking for. The typical person loses 3 to 5 pounds a week. Many men lose 5 to 7 pounds a week. It kind of depends on their muscle mass and their body structure, but the results are phenomenal, and approximately 90 to 95% of the weight that is lost is fat. And that's the biggest difference. If you can maintain your muscle mass and you can lose weight losing fat only, your health improves drastically. I've seen changes in lipid profiles, I've seen changes in hormone production, I've seen changes even in growth hormone production after a few rounds of HCG and achieving a very different state of health. Your body composition, it tells a lot about what you're capable of producing in a weight loss program. If you're very high body fat percentage and very low muscle, it's going to be hard to lose fat. But if you have a decent amount of muscle, even just a normal amount for your height and your age and your gender, then HCG is a very, very good option at keeping your lean muscle that you have and targeting fat alone. We have plenty of testimonials to go for it, but what I've mostly seen in the industry is kind of a kickback of, I've already tried HCG, I went through a program that my friend found online. That's a little bit dangerous. You're playing with hormones literally by ordering from someone online that really has no, maybe they have some education, maybe they have some experience, but they really have no responsibility to you because it isn't a healthcare setting, it isn't someone looking out for you. When people go through weight loss programs and they go through weight loss programs with a physician, it's a very different experience. And here I can tell you, we individualize it each time. We have our standard HCG protocol, but each person is different. Like I said, some people are able to have more protein than others, some are able to have more vegetables than others, some are able to have more fruit than others, and even some are able to have more fat than others. It depends on each person's response. And the way we approach an HCG program, or pretty much any weight loss program, is going to be individualized every time. We go further than just holding your hand. We make ourselves available through email, through phone, through weekly office visits. We are here to provide all sorts of coaching. Many of us in the office have gone through all of the programs, so there's always someone to talk to and identify with because we've been at every stage of the game.